not habit-forming, not addictive, it's not a replacement therapy drug, it's not a narcotic, you cannot abuse it. It's simply impossible to abuse this. Research shows that traditional treatment for alcohol use fails 85 to 90% of the time. Government data indicates a 90% relapse rate over 4 years. Now, most of those relapses occur within the first 6 months. The treatment that I'm here to talk about flips those statistics. It actually succeeds for almost 80% of the time for the people who use it. And most people see dramatic improvement within 4 months. It sounds too good to be true, right? That's why the way that medical breakthroughs have always been. I think you remember when HIV and cancer were basically death sentences. Medical science has given millions of people the opportunity to live full lives. And I stand here before you as proof that the notion of once an alcoholic, always an alcoholic is wrong, thanks to the Sinclair Method. The Sinclair Method was discovered by American scientist Dr. John David Sinclair. His revolutionary research to reduce harmful drinking levels was actually funded by an act of parliament in Finland. The Sinclair Method is backed by science. The concept is extremely simple, but it's completely contrary to the current paradigm of treatment by abstinence. Naltrexone is taken 1 hour prior to the first drink of the day. And over the course of a few months, cravings dissipate and drinking levels decline. Now, this may sound like magic, but it's not. They've got over 120 clinical trials published from around the world that show that naltrexone works specifically this way. The technical term for the Sinclair Method is called targeted pharmacological extinction. Now, naltrexone works by blocking the chemical reinforcement of alcohol in the brain. In order to interrupt that reinforcement and extinguish alcohol cravings, both naltrexone and alcohol must be present. That's why naltrexone is scientifically superior to every other available treatment when it comes to reducing heavy drinking and the percentage of heavy drinking days. However, in spite of recommendations from the VA, from the National Institute of Alcohol Abuse and Alcoholism, SAMHSA, and many more, many doctors are refusing to prescribe this life-saving medication. And those who do prescribe it are doing it in the least effective way, with abstinence. Because when naltrexone was approved more than 20 years ago, researchers were practically forbidden to consider anything short of abstinence as a successful outcome. But as we all know now, moderation is a much safer and more realistic goal. Abstinence. The entire concept of never drinking again for life continues to be one of the most difficult barriers for a person with AUD to overcome. Just say no often means saying no to treatment. And with a 90% projected relapse rate, many people rightly believe that abstinence-based treatments don't work. That's why most people with AUD struggle for at least a decade before we seek professional help. And at that point, our heads are filled up with the unrealistic notion that we can achieve recovery in 30 days or less. That's another problem. Too many people believe that a long-term battle with addiction can be simply stopped in 30 days or less with nothing but willpower or talk therapy. There is nothing scientific about a 28-day rehab stay. Nothing. The American Medical Association first labeled alcoholism as a disease of the brain in 1956. But those with AUD are not treated as though they have a disease. What if other diseases were treated like addiction? Would your doctor refuse to address your high cholesterol or blood pressure until after you had a heart attack? Would your doctor tell you to seek a nutritionist but withhold insulin until after you've proven that you are ready to stop eating sugar entirely for the rest of your life? Would he or she tell you that it's your fault that your cancer returned? This is the reality for someone with an addiction to alcohol. Society and many treatment professionals believe that a person has to hit rock bottom and lose everything before they can commit to recovery. Rock bottom is unethical. It is the polar opposite of harm reduction. It's immoral. And making patients reach rock bottom before medical treatment is given should be considered malpractice. The $35 billion a year treatment system is failing our citizens with AUD. It is largely based on information written by a couple of guys in the 1930s who struggled to maintain their own sobriety. Science has made countless discoveries since then. Researchers have identified functional pathways in the brain and found medications like naltrexone are effective treatments. After almost 20 years of use in Finland, TSM clinics are still reporting a 75% long-term success rate. So why aren't we taking advantage of the Sinclair Method in the United States? Harmful alcohol use costs Americans $249 billion a year. Research estimates nearly a third of American adults will meet the diagnostic criteria for an alcohol use disorder in their lifetime. A third. Alcohol misuse contributes significantly to disease, loss of life, auto crashes, domestic violence, broken families, homelessness, and on and on. We can do so much better than this. Imagine the difference if 75% of people, those who drink harmfully, were able to achieve a real and lasting recovery. I can almost guarantee that each and every one of you knows somebody that needs a little bit of help controlling their drinking. It is shameful that for 22 years we've had the tools to make a real and lasting change in our fight against alcohol addiction, and it's been overlooked, while lives have been destroyed or lost. So what's stopping us now? In the 7 years that I've been counseling people who choose to try TSM, I've provided peer support for doctors and law enforcement and government employees, pilots, and a myriad of others who have a pressing need for privacy when dealing with their drinking issue. Employees are encouraged to seek help, but when they actually do so, their careers might be at risk. The Sinclair Method can be done privately, in your own home. There's no need to miss work or to find time in a busy schedule to attend meetings or to confess your sins and shortcomings to strangers. SAMHSA recommends the use of naltrexone for alcohol use disorder. They maintain a registry for what are considered evidence-based treatments. This registry is supposed to be a sort of clearinghouse of treatments that work and, considering the name, have evidence to back them up. However, it is not that simple. Addiction treatments using medication must include behavioral or psychosocial components in order to even be considered for review as an evidence-based treatment. If they do not, no amount of clinical, practical, or scientific research is enough to elevate a medicinal treatment to the status of evidence-based, even if it's been replicated, peer-reviewed, and published. Now this, in spite of SAMHSA's own report that indicates about 60% of people with an AUD do not have a co-occurring mental illness. So how does the gold standard of science, double-blind, peer-reviewed, published research, not count as evidence of effectiveness when the science indicates significant measures of success? And why are 100% of people seeking treatment for AUD being coerced into receiving the expensive psychosocial and behavioral treatments that only 40% need? The system is stuck in the 1930s. Sobriety and variations of the 12-step program are the status quo. And AA is not the problem. In fact, a person can easily participate in AA and be using the Sinclair Method to get rid of cravings. The problem is that the addiction treatment industry is charging people thousands of dollars for what AA is offering for free, except with some equine therapy and yoga and room and board thrown in. For most people, expensive detox and inpatient treatments do not work on a long-term basis, period. In fact, it often has the opposite effect because of what's called the alcohol deprivation effect. Discovered in the 1960s and backed up by science, the alcohol deprivation effect is a side effect of sudden forced sobriety. Basically, it means when a person is addicted to alcohol and they quit drinking, their relapses subsequently become worse and worse and worse. The $35 billion treatment industry's detox and cold turkey approach triggers that alcohol deprivation effect. And it's creating this revolving door of desperate people who feel that they have no choice but to return to the same industry that failed them the first time. It is an institutionalized positive reinforcement cycle, and the only winner is the bottom line of the addiction treatment industry. Now, how can we reduce the socioeconomic harms of alcohol use if the primary treatment being offered is actually making people worse? Medicare data from 2013 shows that per patient treated, oral naltrexone costs 10% of the name brand injections. I'm sure as elected officials, I'm sure you can see the value of being associated with a program that is both highly effective and saves taxpayers 90%. 88,000 people die each year from alcohol-related causes in the U.S. It's estimated that 47,000 people died from drug overdoses in 2014. With the growing opioid epidemic, the Sinclair Method is a viable way to save money on fighting harmful alcohol use so that funds can be redirected to reducing harms from drug addiction. By lowering the cost of treating AUD while increasing effectiveness, that frees up more funding for fighting drug abuse. Since naltrexone is generic, it must be protected as a low-cost medication. We don't need another EpiPen inflation. And we can see that the cost of naloxone is showing signs of spinning out of control, so it really can happen. Naltrexone is actually a perfect candidate for a shift to over-the-counter status. It's already an OTC in many countries. But if a drug company were to pay the high fees charged by the FDA, the price for the medication would surely rise, once again making it difficult for many to obtain. In conclusion, I ask that you take some time to learn about the Sinclair Method and naltrexone, and continue to create and support legislation that protects the low price of generic medications to ensure those who could benefit from naltrexone will always be able to afford it. And encourage more doctors prescribing through Medicare Part B to treat patients with oral naltrexone instead of the more costly injection to achieve a savings of 90%. And talk to your own doctors and to the people you love and care about. And start to see alcohol use disorder as it really is. It is treatable, curable, preventable. Deaths from alcohol misuse are at a 35-year high in America, and that's not even including drunk driving statistics. One of the most ubiquitous sayings in addiction treatment is the Serenity Prayer. And it states, God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. Now is the time to change the things that you can no longer accept. We have the tools. All we need is the courage to break tradition and encourage our nation's doctors to treat alcohol addiction like the long-term, preventable condition that it is, using an inexpensive, FDA-approved medication that is well-tolerated and non-habit forming. Those with alcohol use disorder desperately want help. We need to make it as easy as possible to attain. The Sinclair Method really does save lives, with a long-term success rate of nearly 78%. You have the power to make it accessible to everybody who needs it. I thank you for listening.